Nursing interventions for gastrointestinal, GI. Bleeding nurses play a pivotal role in the management of GI bleeding, providing critical interventions that contribute to patient stabilization, diagnosis, and recovery. Here are some key nursing interventions for GI bleeding. 1. Initial assessment and stabilization. Immediate assessment. Upon encountering a patient with suspected GI bleeding, nurses conduct a rapid assessment, noting the presence of hematemesis, vomiting blood, melena, black tarry stools, hematochezia, bright red blood in the stool, abdominal pain, signs of shock, pale skin, cold clammy skin, rapid heart rate, weakness. Hematochezia stoolosmosis.org, Hematochezia stool vital signs monitoring, continuous monitoring of vital signs, blood pressure, heart rate, respiratory rate, and temperature, allows for early detection of deterioration and guides further interventions. Blood work and stool tests, assisting with collecting blood samples for hemoglobin and hematocrit levels, electrolytes, and coagulation profile, as well as stool samples for occult blood testing. 2. Hemodynamic management, intravenous, IV access. Establishing and maintaining IV access is crucial for administration of fluids and medications necessary for resuscitation and treatment. Fluid resuscitation, administering IV fluids as prescribed to maintain adequate blood volume and prevent shock. Blood transfusions, assisting with blood transfusions if needed to restore hemoglobin levels and improve oxygen carrying capacity. 3. Gastrointestinal tract management, nasogastric, NG. Tube placement, assisting with or performing the placement of an NG tube as ordered, which can be used for decompression of the stomach to reduce bleeding risk, removal of blood or clots from the stomach, administration of medications or fluids directly into the stomach. Diet management, implementing dietary modifications as prescribed, which may include initially keeping the patient NPO, nothing by mouth, to allow for GI rest and healing. Gradually introducing clear liquids, followed by a bland diet, as tolerated. Stool monitoring, closely monitoring the frequency, consistency, and color of stool to assess ongoing bleeding and evaluate the effectiveness of treatment. 4. Pain management, assessing pain, regularly assessing the patient's pain level and location. Administering pain medication as prescribed, ensuring comfort and facility. 5. Patient education, providing patient education, educating the patient about their condition, treatment plan, and potential risks and complications, teaching signs and symptoms to watch for, informing the patient about signs and symptoms that may indicate a recurrence of bleeding, such as vomiting blood, bloody stool, or severe abdominal pain. Discussing dietary modifications and lifestyle changes. Collaborating with the patient to discuss recommended dietary modifications and lifestyle changes to help prevent future episodes of GI bleeding. 6. Collaboration and communication. Collaboration with healthcare team. Collaborating effectively with physicians, other nurses, and other healthcare professionals involved in the patient's care to ensure coordinated treatment and optimal outcomes. Documentation and communication. Accurately documenting all assessment findings, interventions, and patient responses. Communicating any changes in the patient's condition or concerns to the physician promptly. Additional considerations, emotional support, recognizing that GI bleeding can be a stressful experience for patients and providing emotional support and reassurance throughout their journey. Discharge planning. Participating in discharge planning to ensure continuity of care and providing instructions for medication adherence, follow-up appointments, and dietary management at home.